Well, this is not exactly the update I thought I would be doing for you all. Clearly, I'm in the hospital. This was not planned or expected. I guess it usually never is. When do you plan to go? But it's been a very, very, very rough few weeks since I talked to you all last. So I'm going to tell you more about that right now. But before I do, make sure to subscribe and hit the bell. And stay tuned for this unexpected journey.
Sometimes life's biggest storms give you the most beautiful rainbows. We are chasing rainbows.
Okay, so in my last video, I told you that I wasn't feeling well. I was really sick. I was going to my gastro doctor to try to get answers. I've been having horrible stomach pain. It's been going on for a long time. Some of it for years, other things for months, and some new things that have gotten worse over the past few weeks. So when I left you off, I had gone to the doctor. He scheduled a colonoscopy and endoscopy to be done. He thought that maybe I had a lot of different things going on, maybe like ulcers or a narrowing of the esophagus from the pain I was describing in my chest after I would eat. And he was also looking for things like Crohn's disease, and I can't remember what else he said he was looking for. He had a list. I gave him a list and he gave me a list. I guess that's only fair. So anyways, after that happened, while I was waiting for the appointment to do the colonoscopy and endoscopy, I ended up passing over 30 kidney stones and landed myself in the hospital. Of course, though, I make it to the hospital basically after I passed them all. So no medication and just, yeah, beast mode. That was awful. I thought, it can't get any worse than this, and now I'm here. So I had the colonoscopy and the endoscopy. He did find a polyp. He found ulcers, and he took tissue that looked somewhat suspicious. He's running biopsies on it. I haven't got the results from the biopsies yet. That felt like enough to me between the kidney stones and that. But then when I did go in for the kidney stones, they did a CT on my abdomen, and they saw that there was possible gallstones, and it said that I needed an ultrasound to follow up. So my doctor ordered an ultrasound, and I was supposed to go get that ultrasound today, and last night I ended up in the worst pain I've ever been in my life, like excruciatingly bad pain. I had described this instance to you kind of before, but I get this really bad pain in my chest. Starts out kind of like acid reflux, then it turns to like sharp stabbing pain, and then from there it just evolves and gets worse and worse to where I'm like throwing up, passing out. Yeah, it doesn't seem to end well. Well, this, usually I can get it to calm down. If I take like my Lanta or something, it'll calm down maybe half hour to an hour. This went all night long, and it didn't stop. So Jason and I decided that, enough's enough. I'm not going to be able to make it to the ultrasound, and I was going to try to drive myself there. That was so not going to work. Not with the kind of pain I was in. So Jason took the day off work, and he drove me to the hospital right after we got Jayla on the school bus, and found out that yes, I do have gallstones, and I quite possibly have some that are lodged in the bile duct. So now I'm waiting for emergency surgery. Yay! Yeah, this was so not how I thought things were going to go. But I just kind of wanted to, since I'm sitting here and Jason had to go home to be with Jayla, and they can't stay past 7 anyways, I thought I might as well talk to you guys before everything goes down. So my surgery is going to be first thing tomorrow morning, and hopefully there's nothing stuck, because that could cause added issues. They said that there's 2 different things that could happen. They might be able to go in from another angle to get it out, or they might have to just remove the gallbladder, and then after that's done, I may have to go back to the gastro doctor and have him basically do an endoscopy or a colonoscopy again and go in and remove the stones that way if they're stuck. I am praying they get it all done in one instance, so hopefully that will be the case. So that's where I'm at now. I'm going to end this video with, I guess, an update of how things went after, and hopefully I'll get the results back from the biopsies too and be able to share everything with you all at once. So yeah, thank you for those of you who have been praying for me and sending me messages. I really appreciate it. So yeah, I'm just hoping this all is going to be coming to an end soon, and yeah, I apologize for not putting out content and stuff, but now you know why. So, alright, I'm going to pause here, and then hopefully I'll be picking it up after my surgery goes well, and fingers crossed. I am very nervous. You know, it's like a minor surgery, but it could be a 2-part ordeal that I don't want to do. So, alright, anyways, I'm going to say good night and farewell, and then I'll talk to you either tomorrow or in the next couple of days. Alright, bye-bye for now.
Oh. Alright, update part 2. So the last time you saw me, I was in the hospital and I was waiting on emergency surgery. I have obviously now had the surgery. It's been several weeks later. I waited a while. I've had a really rough recovery from that and just everything that had happened. Mentally, physically, and emotionally, I was just drained. I couldn't talk about it. I didn't want to think about it, and I was just in a lot of pain. I feel like have some tenderness and stuff, but it's not as bad. So I did get the results from my biopsy back from the colonoscopy and endoscopy. So the polyp that they found was precancerous, which is concerning and not. It only really means I have to have colonoscopies more often, so like every 3 to 5 years. So I'm thankful that I had things done in the order that they were, because had they found just the gallbladder issue first, I probably wouldn't have had the colonoscopy done, and then that could have turned into cancer. So I'm thankful for that. And he did also find ulcers in my stomach, so I kind of have to live with and learn to manage those, and which is not a huge concern. The gallbladder was really contributing to most of my issues, which is funny because that is the one that went on the longest, like probably since either before my daughter was born or right after, and she's now 14. So a long time. In fact, I will say, like, definitely advocate for yourself, do your research, because Jason had called 911 for this before. I had had the same fainting spell thing, real sharp pain in my chest. They checked me to see if I was like having a heart attack, and then when it wasn't that, they blew it off and said I was having a panic attack. Wasn't a panic attack. You have to know your body, and like, don't let somebody make you feel like you're crazy. People made me feel like I was crazy for years, and so I just ignored it, and I didn't have the episodes happening like all the time. So it was few and far between that I would have the severe kind of pain. But I will say, one of the symptoms that you have is having pain in your shoulder blade. And I had the worst pain in my shoulder blade for many, many years. And I would go to the chiropractor, I'd get massages or things done, I'd beg my family members to rub my shoulders. And as soon as my surgery was over, no joke, there was no pain there. And I haven't had it since. So yeah, things that you may think may be just normal aches and pains may be related to something more serious. So They did, when they went in, they ended up doing an x-ray while I was getting ready for surgery, or while I was actually on the table. And they put dye through my system to make sure that they got all the stones, and they did, thankfully. I'm so glad I didn't have to have any more procedures. So everything was good there. I will say, like, again, on the point of advocate for yourself, when I came to the hospital that time, I got a really bad emergency room doctor, and I've had him before, and he's messed up. Like, he did a spinal tap on me before, and I still have back pain from that. Not a good experience. He tried to send me home and told me it was only the ulcers that my doctor had found. He didn't want to give me pain medication. I was in the worst pain of my life. I was pacing the room holding a pillow and, like, crying. I would rather do labor completely naturally than do that. That was with twins, I told him. And he totally just blew me off. He wasn't even going to order the test he wasn't going to order the ultrasound. He told me that because I had the CAT scan done, that they saw all they need to see and it didn't look like a surgical issue. Well, my husband had to argue with him and showed him the paperwork that I was supposed to go get this done, and that he was going to call my doctor if he didn't order the test here, that he was going to have my doctor order the test. And he finally agreed to do it, but he was like, it doesn't look surgical. Well, within 15 minutes, I had surgeons flooding my room and telling me that I needed to have surgery, like, now, because they think stones are stuck. So, and that's actually, I didn't realize this, but you can come up with a cocktail to help you pass gallstones, and I kind of did it on accident. So Jason had bought me a bottle of Martinelli's, which is sparkling apple juice. I think he got it actually for, like, during my colonoscopy prep, so I had something good to drink, but I didn't drink it until the night before this happened. So I drank, like, the whole bottle of this stuff, which apparently apple juice is supposed to relax your gallbladder and open it up, and so you could possibly pass stones. Well, I started to have an attack, and I took magnesium. Well, magnesium kind of works as, like, what's the word? I can't think of the word. It can cause diarrhea or for you to pass things. So my body started to pass stones, and actually they said I did pass some of the stones. And the reason why I was having such severe attacks is when stones were trying to pass, they would block the opening from the, see if I can remember all this, from the gallbladder to the liver, the duct there. It would block the opening, and I guess that constricts blood flow and can cause your blood pressure to suddenly drop, which is why I would faint. So it can be pretty serious if you're having symptoms like that. Definitely go get checked out. But I'm relieved that it's over, so I am hoping to, like, resume a new kind of normal. I got a lot of new things that I'm working on that I started. One having to do with my daughter Paisley Grace that I lost at 18 weeks. So if you're new here and you're like, what is this channel normally about? It's all about miscarriage, infertility, and life beyond. I have had 3 miscarriages, so her due date actually passed while I was recovering from the surgery, which was kind of hard because normally we have, like, traditions of things that we like to go do to remember the babies we've lost and honor them. But I found a new way, so I'm excited to tell you about it. I'm not going to share it in this video, but I've been working on something to, like, not just carry on her legacy and name, but also help educate others and help others who are struggling with the same thing. So stay tuned for that. Subscribe and hit the bell if you're interested in more content like that. And then also just daily life. So I'm trying to find what normal looks like. I went for months of not being able to eat and just being so out of it and not wanting to do anything. It just felt good to have some energy back. So hopefully I'll be able to pick up the camera more and share more with you guys. So I'm excited for that and relieved that this is all kind of coming to a close. It's just so weird that, like, I've had all these problems for so long and a lot of them are, like, lifting, and I feel like this new human being finally again. So anyways, all good news. Thank you if you watched this video all the way to the end. Comment down below if you have had your gallbladder out or had any symptoms like this before, or just whatever's going on in your life. I would love to hear it. So thanks for listening and for watching today's video. I'll see you next time, and until then, I look forward to chasing more rainbows with you. Bye-bye for now.
Thanks for watching today's video. Before you leave, make sure to subscribe and give this video a thumbs up. This tells YouTube to share this with others who need it just like you. Also, be sure to follow us over on Instagram and check out the link for my family's channel in the description. Also in the description, you will find link to our store, Chasing Rainbows, which has products for miscarriage, infertility, and beyond. If you're interested in having a custom-made product like one with your angel baby's name on it, then send us a DM over at chasingrainbows_store, and we will send you a custom link with a full line of products just for you, no obligation to buy. Otherwise, check out our ready-made lines right now. And be sure to visit umbrellaofsupport.com for all resources pertaining to miscarriage, stillbirth, child loss, infertility, special needs children, adoption, and foster care. Remember that life is done better in community. Check back for more videos, and I look forward to chasing more rainbows with you.